Myself Prabhanshu Vyas. Today we will discuss about the historical development of community health nursing. In this first we will discuss about the historical development of community health nursing in the world. Then we will discuss about the historical development in India. Ancient period, the history of public health and public health nursing can be traced far back in the past. In earliest time, people struggled for their survival by devising their own method to dealing with life events such as birth, death. In ancient period, the history of public health and public health nursing can be traced far back in the past. Earliest time, people struggled for their survival, by devising their own method to deal with their life. People were concerned about disease, had some knowledge about of its treatment. Medical care was given by religious leaders and priests who were reversed by the society. Record history of ancient civilizations such as Babylon, Hebrew, Greek, and Roman revealed that they possessed knowledge of personal hygiene, community responsibility, and medicine. In past, people were concerned about the disease. They know the disease and had some little bit knowledge about its treatment. Medical care was given by religious leaders. In past, if anybody is suffering from disease, the treatment was given by religious leaders and priests. Then record history of ancient civilization such as Babylon, Hebrew, Greek system of medicine, Roman system of medicine, that they needed was knowledge of personal hygiene, community responsibility, and medicine. Babylon, Hebrew, Greek, Roman, they reveals the human being is having a knowledge about the personal hygiene. Everyone knows hygiene is a very important part of health. Then community responsibility and little bit knowledge about the medicine. For small disease, they had well developed system of environmental sanitation such as safe water supply, drainage, sewage disposal system. They also had understanding the contagious nature of disease. In past, they know about the importance of environmental sanitation like safe water supply and drainage system. In ancient history, when we discuss, they first for safe drinking water, they filtered. Before using of water, they filtered it, then they drink and they use drainage system, disposable of waste. They are knowing about the different method of disposal of waste. And they also had understanding the nature of disease. They know that disease comes through poor sanitation. This result, the rigid public health measures like isolation of sick, quarantine of the families, and sometimes of the communities. In India, we will discuss public health measures like isolation. In India, if a person is suffering from smallpox, community isolation. Patient is isolated in a specific room. So isolation and quarantine of the families. Some time of the community. The philosophy of the time was that the individual should provide for the basic need for himself and his family. His responsibilities included the provision of food, shelter, clothing, and care in case of illness. The community responsibility was to protect the individual and his family against illness that might be due to communal life. His responsibility in ancient time, personal responsibility to provide food, shelter, and clothing, care is in case of illness. If any family member, head of the family, is having a responsibility to provide a shelter or food to the family, provide family, and if any family member is suffering from any disease, provide care. The community responsibility was protect the individual and his family against illness. Community is also having the responsibility to protect from numbers of diseases for each and every family. The development of modern public health and nursing took place from the middle of the 19th century for England and America and various other countries as a result of occurrence of great epidemic of plague, leprosy, smallpox, and cholera. During 18th century, early 19th century, England faced industrial revolution, which created tremendous social impact in terms of social economy, imbalance, explosion of work, slums, poor sanitation, broken family, child abuse, maternal and child health problems. In the 18th century, England faced industrial revolution. Industrial revolution, then tremendous social impact. Industrial revolution caused tremendous social impact and socio-economic imbalance. Slum area developed due to industrialization. People moved to rural area to urban area. That caused slum area. That was because of overcrowding. Slum areas developed. Oversanitation is also developed. Broken families. For early a member of broken family occur child abuse and MCH care problem, maternal child health problem. During 19th century, in spite of the act being passed and implemented to improve the environmental sanitation, this disease continues to occur time and again in the Western world. This was because of the fact that epidemiology of disease was not fully understood. And during 19th century, the act being passed to implemented to improve environmental sanitation. In this we know the disease contamination. Then we will discuss this was because the fact epidemiology still here were not fully understood about the disease, how diseases occur, and incubation period of the disease. Miss Florence Nightingale has been recognized as one of the foremost pioneers in the public health nursing movement in England. She is acclaimed as the founder of modern nursing. She began her from when nursing services which were established by religious order were away with the decline church power and influence. She began her work when nursing services which were established by religious order Then, away with the decline of church power and influence, Florence Nightingale create an atmosphere of dignity and self-respect for nursing. In America, similarly, development took place in the field of public health and public health movement. Gained momentum in the year of 1850 when Daniel Shaker, a publisher and bookseller, submit a report on sanitary condition of Manchester to its legislator and also published the same. In his report, he put forward specific recommendation regarding a system of sanitary inspection, collection of vital statistic, school health program. In the year of 1872, American Health Association, a national level profession organized of community health workers was established. This association initiated various public health campaigns and has consistently worked for improving standard of community health service. The field of public health branded under the influence of scientific advances in microbiology, social and behavioral science. Field of public health understands the influence of scientific advances of microbiology and social behavior. When scientifically our knowledge is improved and when microscope invent, then we will discuss about and we understood about the microbiology and about the bacteria, viruses, numbers of things. Then we will discuss about the society and behavioral of human science. Thus, in late 19th century and at the beginning of 20th century, a new concept began to take impact that the state has the direct responsibility for the health of people. Public health activity not only included the activity to improve sanitation and control of communicable disease, but also prevent and promotive service to mother, child, school children and elderly. Then we will discuss, understand, public health activity is not only include activity to improve sanitation. This is not only improving sanitation, public health. Public health is not improving sanitation or supply proper safe water, but also concerned to prevent and promotive services for mother, for children, for school going children, worker and adult. Why? Because if mother is sick and when during pregnancy a mother is sick, a baby comes a sick baby. Or baby is having a number of chromosomal defect or genetic problem. If mother is healthy, then baby is children. When baby is or children is having a 1 to 5 year old, during that time he or she is suffering from any of disease and not treated properly, he or she is having a lifelong problem. Or he and she is having any deformity during that time, he and she is having a lifelong problem because of disease. School going children, workers are stressful situation for a local family, so public health is also very important for the workers and the elderly. Numbers of elderly or genetic problems are facing. The elderly people are facing numbers of problems like hearing loss, vision loss because of fat loss, muscle weakness. Because of weakness, we are having numbers of problems. they are not having a teeth, so they are not able to eat anything, and then they are suffering from anemia. Then some associated diseases as caused. They are not able to walk properly, so constipation is over. Constipation occurs when digestive system is not properly. Then digestion and absorption of microelements are hindered. So this is not concerned only for a sanitation and supply of proper water supply, safe water supply. There are in numbers of NCHK, other child healthcare, school going children, work everywhere. The need for the application of principle of personal hygiene, care and health teaching was felt in all these public health services for controlling mortality and morbidity among mother, children and workers, etc. to and improve and promote their health. Personal hygiene care health teaching was fed in all these public health services to controlling mortality. Personal hygiene, everyone knows hand hygiene is very important for prevention of numbers of diseases. So personal hygiene and health teaching. Health teaching is very important to prevent prevention from disease, like health education about the corona, COVID virus, how COVID virus is spread to one person to another person. Then discussing about the food poisoning, typhoid, hand hygiene prevent typhoid, personal hygiene, regular bathing is important. So they think reduce the mortality and morbidity, death and disease growth. When a person comes eating anything before the person is eating, hand hygiene. And hand hygiene is maintaining he and she prevent typhoid, polio and food poisoning. So it will be immediately effective to reduce the mortality and morbidity there among mother, children, and if mother is knowing about the healthy diet, baby is healthy. This phase of public health gave origin to public health nursing. During this period, the foundation of district nurse through private, voluntary and offered were laid. And 1890-21, such organization exists in USA. In 1893, Leonard Well, the pioneer of public health nursing, founded the Henry Street Settlement, which grew into a well-organized health center with visiting nurse service for the surrounding community. The Rockefeller Foundation of New York, established in 1930, adopted public health as one of its fields to interest. This foundation assisted the establishment of a school of public health in United States and other countries. The Rockefeller Foundation provides money and their knowledge to other countries for prevention of disease, especially in school culture. American Red Cross Society, the Commonwealth Fund and foundations were they other voluntary and private bodies which were very active in the development of public health and public health nurse service. During early part of 18th century, there were specialized nurses in the field of public health like nurse, maternal, NCH care, vulnerable disease, communicable disease and tuberculosis control. Public health entered the novella. It was faced with a new emerged health problem which were more serious but chronic and degenerative, such as cardiovascular disease, cancer, stroke, mental illness and metabolic disorders. Thus public health deals with wide range of health problem and its activity move beyond the traditional basic services which include communicable disease control, environmental sanitation, maternal child health, health education, medical nursing care, nutrition and vital statistics. There are wide range of health problems and its activity beyond the traditional basic services, which include communicable disease control program, environmental sanitation, MCH care, mother-child health care, health education, medical care, nursing care, nutrition, and vital statistics. The field of public health broadened increasing emphasis was given on primary health care and prevent and promotive services. Further, as a result of Alma Ata declared goal health for all through primary health care by the WHO UNICEF in the year of 1975. Ancient period, the development of public health nursing in India started much later as compared to developed countries of the West. But public health in India in practice such much before its development in Western countries. The Indian ancient period, the development of public health nursing in India started much later as compared to developed countries of the West. But public health in India was in practice much before its development in West. In India, public health nursing started later as compared to developing West. But public health in India was practiced much before its development in Western countries. The Indian history revealed its public health practice as early as 5000 BC. The period can be classified as Vedic period and post-Vedic period. In India, the history reveals its public health practice as early as 5000 BC. The period can be classified as a Vedic period and post-Vedic period. During the Vedic period, the script book Unpunished and Veds, especially the Atharva Veda, documented all the knowledge about medicine, personal hygiene, prevention of sickness. In India, Atharva Veda document as a knowledge of medicine, personal hygiene, prevention of sickness. In India, the Indian system of medicine is known as a Ayurveda. In this Ayurveda, they know about the medicine, personal hygiene, and how to prevent disease. In Ayurveda, they make a kara, which is an abstract of jari booty. Jari booties are made up of leaves and roots of the plant, and they are using the everything of plants like leaf, roots, and all the things. Then they make a mixture and they crush all the things and make a card, and they give to the person who is sick in the form of liquid. In the form of kara, they are also practicing a lab. Lab is nowadays the lab is known as a ointment. The post-Vedic period, 500 BC to 700, start with the rising of Buddhism. Buddhism embodies the principle of non-violence, helping the sick, poor, and needy people. Self-discipline, self-education, and charity towards all men. After the post-Vedic period, the Buddhism developed. The Buddhism shows in the king अशोक का जो साम्राज्य आया था उसमें जो अशोक जो था दे मेड अ फर्स्ट हॉस्पिटल फॉर cattle. They provide care to the cattle and they also give care to the poor and sick people on needy. British Empire. Then after British Empire, before the British Empire comes, Mughal Empire comes. They bring a medicine, Unani system of medicine. Then Britishers come. In 18th century to 1947, the British had established its rule in 1757 by establishing civil and military services. In 1859, the administration of India was taken over by the Crown from East India Company. The Britishers comes in India in the form of civil and military service. They provide us civilian and military service to the King of India. And in the year of 1957, there comes under as a company, East India Company. They provide services or provide things to the kings, and they after that they capture the king's empire. In the year of 1859, the administration of India was taken over by the East India Company. In 1859, the Royal Commission, which came to India, studied the problem, recommended to establish sanitation commission of 5 persons, each in Bengal, Bombay, and Madras. In the year of 1859, the Royal Commission, which came to India to study the problem and recommended to establish a sanitary commission of 5 persons, each from Bengal, Madras. Nowadays, Madras is known as a Chennai. Bombay, nowadays Bombay is known as a Mumbai. And Bengal is known as a West Bengal. In the year of 1896, following the outbreak of epidemic of plague, a plague commission was set up to investigate its epidemiology aspect as a result of investigation and suggestion. In the year of 1896, a plague is epidemic. A plague commission was set up by the government to investigate and its epidemiology aspect as result of investigation and suggestion. In the year of 1912, the local government body were made responsibility to execute various health services according to overall plans and direction of central government. In the year of 1939, some very important development took place. The Madras Public Health Act was passed for the first time in the country. The first rural health training center was established at Singur near Calcutta with the support of Rockefeller Foundation. In the year of 1943, Health Service and Development Committee existing health commission and health organization in the country and to make recommendation about the development in Bharat. The development science since independence 1947 onwards. Before India attained independence on 15th August 1949, some of the provisions and princely state of India were part of Constitution Pakistan. This affect change in the demographic, political and socio-economic aspect. At the same time, a large number of people for Pakistan migrated to India. The government of India at that time faced a large number of socio-economic public health problems, but because of new constitution policy and the enthusiastic attitude of political leaders, administrators, and the people in general, the government could manage to overcome initial difficulties, implement strict public health measures to prevent epidemic. Planning Commission was established to help government to plan out integrated development plan for the entire country with in the available resource for a defined period of 5 years for a socio-economic progress. In the Planning Commission has been responsible for 10 5-year plan. Community nutrition. So in this chapter we will discuss about the historical development of community health nursing. First we will discuss about the world, then later we will discuss about the India. And nowadays India Planning Commission is converted into the प्लानिंग कमीशन कन्वर्टेड जो अब नया कमीशन आ गया है उसके तहत काम चलता है और अब आयुष्मान योजना भी आ चुकी है. नाउअडेज आयुष्मान योजना टेक प्लेस एंड NHM and NRHM. थैंक यू.